There's a good chance you or a family member have done a virtual doctor's appointment in the last year or so, as telehealth has become more of a necessity during the pandemic. But without a law change in Minnesota, those visits would go back to how they used to be pre-pandemic, where there were a lot more rules to follow. Sarah Danek is following a bill that allows telehealth to stay how it is right now.
Right now during the pandemic, there are a lot less doctor's appointments happening in offices and more happening virtually. Places like on your phone, from your car, from your house. Now some medical advocates and lawmakers want to make sure it stays that way.
So tell me, how are you doing?
Telehealth appointments have become the norm now, but that wasn't always the case a year ago.
We had a lot of aspirations to have telehealth up and functional before the pandemic, but then it was a very quick and really appropriate transition that we were able to offer.
COVID precautions forced the medical world to quickly pivot in order to see patients, and those on both sides of the call are finding they like it.
In terms of access for patients, telehealth is an amazing thing.
Minnesota Community Care says they still see people in person, but estimate about 15% of their patient visits are being done via telehealth. Other estimates are even higher.
Telehealth went from less than 2% of visits in 2019 to nearly 30% of visits in June of 2020.
A state executive order currently eases some telehealth rules, and new bills in the House and Senate aim to keep that greater access available, allowing patients to attend appointments wherever they can, from home, work, even their cars. It would remove a limit of 3 telehealth visits per week and would allow patients to use their telephone for appointments without requiring a video feature. The Minnesota Hospital Association is also behind the change, saying it's about putting the patients first.
We just are asking our lawmakers to make permanent the changes that were temporarily put in place so that we can continue to serve Minnesotans across the state and all of our diverse populations.
Now, this is a bipartisan effort. Similar bills are being discussed in both the House and the Senate, but there is a sticking point, and that's how much this should cost. Some people arguing that it should be a lesser cost because you're not seeing a doctor or medical professional in person. Others say the same amount of work is being done no matter where you are. Sarah Danek, Fox 9.